everybody, welcome back to my channel. So today we are going to talk about assessment station. So in the assessment station, it's the very first station in your SK exam in the API section. So assessment, then the second one is planning, then implementation, evaluation, and then your skills. So assessment nowadays, because of COVID, they have reduced the time. It's 12 minutes only, and in this 12 minutes you need to follow the marking grid, okay, and then you are going to do the observations. So I have already made a video about assessment station, including GCS score and must score, even the PHQ. So today we are going to do only with observation, which is only for your news chart. So let's begin it, and we are going to follow the marking grid today. Okay, so guys, make sure in the exam this is your first section, so you need to be very careful and confident. So you need to practice a lot. It seems easy, and then but in the exam, if you are confused, you won't get it. 12 minutes are not enough to do assessment, including activities of daily living and the documentation. So you need to practice it every day before your exam. Okay, so we'll start. The first thing we are going to do is pre-procedure check. So pre-procedure check is you are going to check for the scene safety, you are going to maintain patient privacy, and then you are going to perform hand hygiene by stating all the process involved. Okay, so this is the pre-procedure check. So how we gonna do it? I will say I entered the room, I check for the scene safety, scene is safe, there are no hazards, I draw the curtains for patient privacy, and then I'm going to perform hand hygiene. If you want to use hand wash, go ahead, but you won't have enough time, so you can say that as my hands are visibly clean, I'm going to use the alcohol hand rub. Okay, you will take the ample amount of the hand rub, then do it according to the WHO guidelines. So palm to palm, palm over the dorsum, fingers interlace, fingers interlock, thumb rotation, tips of the fingers, wrist to elbow, and allow the hands to dry for 30 seconds. So this is your pre-procedure. In some scenarios, examiner may say pre-procedure checks have been done. So that's the time you are going to start only with the introduction. Okay, so be very careful about the instructions from your examiner, what he or she is saying to you and what you have to do. Okay, the next step we have to follow is the introduction. In the introduction, you are going to introduce yourself and then explain the purpose of the nursing encounter and then gain consent. Okay, after that you need to check the patient's ID, full name, date of birth, hospital number against the ID bands and the notes you have. Okay, so in the community setting, you will be checking for the full name, date of birth, and address of the patients, and then you will check for the allergies as well. So you will say, my name is this, and then I have come to do your observations. Okay, and then is that okay for you? If patient will say yeah, of course, go ahead. Then can I please check your details with the ID band and the notes I have here? You will check for the name, your date of birth, and the hospital number. Then you are going to ask about the allergies and their reaction. So after that, you are going to, since it's the first station, you won't be knowing the patient before, so you can ask the patient, do you know why you are here in the hospital or in the community setting? And then patient will give you the reason, and you can tell the patient, yeah, I know that you are here because of this situation, and then we have to take a set of observations on you, so we can make a care plan according to that. Okay, and after that you will check the patient's surrounding to get any cues about their lifestyle and their habits. For example, if there is a pack of cigarettes, you can ask them about that, if they are a smoker, if they smoke, and if they would like to quit smoking. Okay, then before starting the procedure, before taking the observation, you are going to ask about the patient comfort, if they are in pain or if they need hearing aid or something. Okay, then you will start the procedure. Meanwhile, doing these things, you need to perform hand hygiene very often. Okay, so don't forget to do the hand hygiene. Okay, now you are going to start with the observations. You can tell you will check for the functionality of the equipment, like the BP cuff you are going to use. So in this section you will not be having a mannequin, you will not be having you will be having a mannequin, but you won't be having a dynamap, the BP apparatus and thermoscan, things like that. So you can just tell the examiner that I will check for the functionality of the equipments, and then if they are clean, our next test due date is still valid, and then you will take the appropriate size of the cuff. You can just verbalize, and then you need to start with the blood pressure. Before checking the blood pressure, you can say that ask the patient like, which arm would you like me to use for your blood pressure, and then ask the patient, have they ever had any surgery on this arm, is there any fistulas or cannulas or things like that. If everything is okay, then you can proceed with the blood pressure checking. Then the second thing, you need to check the patient's oxygen saturation level. You can check if patient is having any false nails or any nail polish or something like that. You can tell the patient that since your nails are clean, there is no artificial nails, no nail polish, so I'm happy to check the oxygen saturation on your finger. You can still ask the patient which finger would they like you to use for the oxygen saturation. And then while checking the blood pressure, you can tell the patient that when I turn it on, it may squeeze your arm for a bit, so don't worry about that, it will be there only for few seconds. Okay, then you're going to check the temperature of the patient. So make sure patient, if they have any hearing aid, okay, you need to remove that before checking the temperature. Okay, so if they don't have hearing aid, go ahead, but if they have the hearing aid, you need to remove it and wait for 10 minutes before checking the blood temperature. Okay, then you need to ask the patient preferences, which ear they want you to use to check the temperature. Okay, and then you need to visualize the ear. You need to check the ear if there is any discharge, any redness or any inflammation. If nothing is there, ear looks clear, then you can go ahead to check the temperature. And then again you need to explain to the patient, I'm going to take temperature from your ear. This is a tympanic thermometer, and then when I press it on, you will hear a beep sound, so don't worry about that, it will be there only for few seconds. Okay, then you are going to check the pulse of the patient. Okay, pulse and respiration. So don't tell the patient that you are going to check the respiration. Okay, you can tell the patient, I need to check your pulse for few minutes, and then after, then you will not be having a real patient, right? So it's just a mannequin. You can say that I assume that it's already been 2 minutes, and then I have taken your pulse for 1 complete minute and 1 complete minute for your respiration, and then I didn't tell you earlier because I didn't want you to alter your breathing pattern. I'm sorry for that. Okay, and then you have taken your blood pressure, your saturation, your temperature and respiration and pulse. So everything is completed. Now you can say the patient, thank you so much for your time, give me few minutes, I will just go and document all the readings. And then in between checking blood pressure and pulse and everything, you need to maintain hand hygiene. Okay, and then you will document it. After documenting it, you can ask the patient, would it be okay if I tell you the results aloud? I have completed the news chart, so you will say all the results to the patient. This is your respiration, this is the score, this is your SpO2, this is the score, blood pressure is this, and this is the news score. Okay, then at the end you will calculate the score and tell the patient what is your frequency of monitoring the patient. Okay, and then at the end, when you are done, you are going to ask the patient, would you mind if I ask you some questions about your activities of daily living? So in your assessment form, on the first form, it will be there like which questions, which activities of daily livings you need to focus on. So that's just for your guide. Okay, if you don't come up with any activities of daily living, like if you don't come up with any questions in your mind, you can just think about that. The two written on your, there will be two written on your assessment form. Okay, you can ask the questions about that activities of daily living. You can tell them like, do you have any problem with mobility? Do you sleep well, or is there any issue with your eating habits? Are you eating proper diet, healthy diet? And then whichever is there on your assessment form, according to the scenario, you're going to ask the activities of daily living. Okay, I hope this video was helpful. I tried my best to complete the assessment station in 10 minutes. Okay, so if there is any questions for me, please don't hesitate to ask me. Share the video with your friends and colleagues, and please don't forget to subscribe my channel, like and share. Okay, take care.